Hello, can everybody hear me?
Yep. Yep.
How is everybody doing today?
Lisa, doing good.
Allison has graced us with her presence today, so thank you for joining. Looks like we have some new faces on as well, so welcome.
Hi, my camera's off completely.
Hey Lisa, how are you today?
I'm all right.
Awesome. I'm going to spend some time and talk through some things, hormones that I have pulled up and wanted to run through. But with the new faces, I wanted to see if anybody um, is interested in talking to coaches, myself, Allison, our whole team is here. If you're in the program or currently on the fence about joining the program, we'd love to unpack your questions and concerns. I'm going to give a couple minutes, and if not, I'm going to pull up some stuff and walk through a couple pieces of information. There you are. All right. So, some of the things I wanted to talk about because I see it's such a relevant conversation with a lot of the women coming into the program is differences between bioidentical hormones and synthetic hormones and potentially actions on the body. So, traditional medicine we see, and I'm not knocking it, a lot of use of contraceptives, synthetic progestins, synthetic estrogens. And I think there's not a lot of patient education around that. And birth control definitely can serve a purpose. So we'll talk through a couple of the benefits. Obviously it's going to stop you from ovulating. So if conception is something somebody's worried about, it makes a lot of sense. Other types of reasons for it, use of birth control is potentially um, some sort of tissue sensitive cancers. I absolutely think that birth control has a place, but what I think is happens more times than not is maybe the over prescribing of birth control to manage symptoms. I don't know if the coaches would agree with me, but we do see a lot of that. And I wanted to talk through some of the actions of synthetic hormones and bioidentical hormones to start and kind of talk about some of the side effects. So, some of the things that you'll see with specifically progestins. So, you could think of like a Mirena IUD. Um, Even though it's localized, it is still will have some systemic effects. You're really missing out on the potential benefits of the anxiolytic properties of progesterone. So what does that term mean? It's very calming to the brain. Um, Women will make larger amounts of progesterone in their luteal phase and smaller amounts throughout the month. Really, the bioidentical progesterone, what your body makes, is going to help calm the brain. There's also some research supporting progesterone helping cardiac tissue, so just the contractions of the heart and regulating. So low progesterone, I see a lot of times associated with insomnia, heart palpitations, change in mood. When we look at using a synthetic hormone, potentially we're missing out on the benefits of working off the GABA receptor and really losing some of the calming effects. Other things that I see with synthetic estrogens, so that ethyl estradiol is something I see a lot of women coming in and using. Those things can potentially act on different receptors. So bioidentical estrogen, which your ovaries make, really work off of estrogen receptor beta. Um, you both have alpha and beta in tissues all over the body. Um, Other piece is going to be the liver having to do a lot of work. So if you've listened to any of our calls, any of our coaches are going to talk a lot about supporting liver as it plays into lots of other hormonal, endocrine, gastrointestinal reasons. Looking at using something that is native to your body and potentially something that's not first pass is going to first pass through the liver is going to have some some potential better benefits. So, last piece I wanted to hit on, for general information, is when we use things to stop ovulation, we're disrupting your normal hormonal flow. So we think about your brain creates all of the signaling hormones to help produce testosterone, estrogen, progesterone. And when we inhibit those hormones, there can be other sorts of dysfunction. So one of the things I wanted to talk about, and if you have done a lab review with me, I've shared this with lots of people. Now, this study was only on about, I think, 5,000 women mm, from 2007 to 2012. But the thing I worry most about is potential dysfunction at thyroid hormone. And I think that's something that's not really brought up that much. So, this study talks about the duration of thyroid hormone. Um, so females 18 plus who had a history of taking birth control and thyroid function was included. History of birth control was based on response and reproductive health. Um, the results are, 5,100 women with a history of birth control and without were included in a higher prevalence of hypothyroidism. So I just kind of wanted to share this. I'm sure somebody will watch this as we upload these replays. And, I see a lot of times that we come in working on one thing, if that's potentially balancing hormones, a lot of things can also become dysregulated. So I think this birth control piece in hypothyroidism is not talked about enough. And, potentially uh, this could put a lot of women in position to have issues with slower metabolism, other dysfunctions of other hormones. So if we stop ovulation, progesterone may lower, testosterone may lower, we may have issues with thyroid. If anybody wants this, I can send this to upload it so you could take a deeper look at it. But I had talked to 3 women this week about this, and I wanted to shed some light, maybe in a larger setting of potentially other avenues to look at managing hormones um, outside of just traditional birth control. So I hope that was interesting. I don't know if any of the coaches have any feedback or any questions or anything they'd like to add. But again, I'm not demonizing hormones. It's just, I think there's a lot of ways we can cut the cake. And I think it's kind of a blanket statement from a lot of providers that we just birth control. You got heavy bleeding, birth control. You got acne, birth control. I just think that looking a little bit deeper makes a lot of sense instead of just generally prescribing a drug for people. Um, Maybe from like a GI or even from like a detox standpoint, do we have any input from Charlotte, Ashley, things that I'm missing that also birth control can counteract? And Lisa, I see you have your hand raised. Definitely get to you as well, but I'm just curious if the coaches wanted to input anything on that.
Yeah, I think it's first and foremost is like the more knowledge you have, the better you can go prepared into your office and have much more better conversations and see if your doctor's open to what you're saying. The more informed you are, the better care you're going to choose, or at least you'll look for different avenues, the more that you know. This has served me very well in a lot of my earlier years when I had a lot of issues with PCOS and horrible periods. And I just constantly questioned, like, well, why? Why would I do that? This doesn't, and so I was that patient probably that the doctor's like, oh my gosh, this girl. But it served me well. And I ended up, making a lot more holistic choices. But I will say the road was more painful because I took the longer route around of like how to actually take care of my body. So I think that's also important. Like when you do choose more natural paths, it can be a little bumpy and it's not just going to be a quick fix it, which I think where modern medicine really does shine and it does a great job of like killing the pain pretty quick. I think that's all right. And so it's a little bit hard to pick a route that could be a little bit more challenging. The learning curve is going to be there and figuring out what works for your body. When it does come to hormones, like The liver is very key in processing all of that. So what works for some and doesn't work for you may be just a determined factor of where your liver is at, phase one and phase two pathways. Is one sluggish and one is fast? So it does matter where your liver's at when you do go and take all these medications because they will play a role. They will cause inflammation at some level while also lowering a symptom. So all I can say is keep studying the liver. It's very important. It's very fascinating, and it will help you make more comprehensive decisions. If you do choose to take medication, at least understanding what are the side effects that are happening, then you can start connecting the dots down the line. If you start to feel off, or you're like, man, what? Now I'm having this problem. The more you know about your organs, about the medications, the more you can connect the dots if you seemingly need to down the line. So that's my 2 cents.
Helpful. Thank you.
Yeah, I'll speak to gut health too, specifically regarding birth control. So specifically estrogen and progestin can alter the gut bacteria. It can contribute to gut dysbiosis or an imbalance of bacteria in the gut, both the good and the bad. It can, so consequently, it can impact digestion, it can impact nutrient absorption and inflammation. So birth control can increase certain of the bacteria like the Bacteroides, but it can also reduce like lactobacillus. So that it can just mess with that balance. If you already have leaky gut or almost leaky gut, it can contribute toward that too, just because it can inflame the gut lining. And so it can, that obviously just when you have inflammation of the gut lining, then more likely to have react to foods and it can trigger or flare up autoimmune diseases as well when you have that inflammation in there. I know it can impact like if you're dealing with anything, you're dealing with Crohn's and stuff like that, it can impact that. And also just nutrient depletion. So like hormonal birth control is known to deplete B vitamins and magnesium and zinc. So anyway, Candida is another one. It can contribute to Candida or just promote the growth of it. So yeah, anyway, lots of fun things for for birth control.
Yeah, I think it's really interesting on the nutrient absorption piece because we give a medication, but we're not necessarily talking about cofactors and other things our bodies need to regulate. If we're using a drug to inhibit one thing, and then you could end up with a bunch more side effects. So, I think a lot of times, just taking a deeper stance and looking to figure out what's going on with your body. The body is such a resilient thing that you can fix a lot of things just holistically. And then if you need support, I really think that we're coming into a time where bioidentical hormones are more talked about. They're used safely, and I think more data will come on that. So I appreciate the insight from you too. Lisa, not Coach Lisa, Lisa Dahl. I know you had your hand raised. What questions you got for us, or what are you seeing out there? I know you're talking daily to women.
Yeah, I'm seeing a lot. Like I'm really appreciative that you went over that. Because I am seeing a lot of women using that form of birth control, thinking that it, is an easy, safer option, but yet they still have multiple symptoms, right, that they're dealing with. And we know how much the thyroid controls pretty much everything to a degree, So I found it really, really helpful that you did that. And then in terms, I do have a question versus the Mirena and the copper IUD. Is there a little bit of information you can share about that?
Yeah, they're both going to inhibit ovulation. One's non-hormonal. My thing is, how do we stop ovulation? That's an inflammatory process that's happening at the body. And I think a lot of times people say, well, it's localized. It's only at the uterus. Like it's not going to impact other things. But if you've ever seen an image of one of those things taken out after 8 years, they're rusty. And I don't know about any of you, but I wouldn't want any rusty pieces
Oh,
sitting in my body. So I really think about, if that's inside of you, what other
Yep.
inflammation processes are happening? So just because it says it's hormonal free doesn't mean it's going to not come with any side effects. I was working with Allison because we do a lot of the medical stuff, and we were looking at someone who was on the Mirena IUD and I'm sorry, the copper IUD, and we did a Dutch test on her, and she was like, "Well, it shouldn't impact my progesterone. It won't." And more times than not, you see a lower level of progesterone and lots of changes from the HPOA. So just from brain to ovaries, that signal changes quite a bit. I also think it's really interesting that you can use, I believe the Mirena, they approved it for, I think it's 6 or 7 years for contraceptive, I'm sorry, for hormonal support. And it's up to like 10 years now that you can keep that thing in you for contraceptive support. So um, I feel like we're stretching timelines on those things. And if you're not getting any action from that progestin, what is in that IUD that is stopping you from conceiving? Uh, I know for some women, menstruation is a chore. Again, I always say this, I can empathize, I cannot relate, but um, really figuring out like why you're having those issues, if it's heavy bleeding, sore breast, and kind of tackling those things makes a lot more sense. Because if we are just looking at using a contraceptive, probably missing a lot of other pieces in the body. There's dysfunction happening. So I think it really comes down to maybe using a cycle tracker, flow, something like that. Figure out when you're ovulating. I think it's like 48 to 72 hours in that time frame where you can conceive and maybe not engage or use safer methods instead of suppressing all of your hormones for a single outcome. So that's just my stance on it. Again, no one's ever offered me birth control, but I would probably assume everybody on this call has been offered birth control, and it's may not something you are fully educated on. I see girls 14, 15 years old on birth control, and it's just the way it's been for, till they're 40, and now they have all of these other issues associated with it. And OB or PCP is like, it's not the birth control. I don't know, here's an SSRI or here's an SNRI. That should help you feel better. And I really think that taking an integrative approach, specifically with women hormones, because women as a whole have not really been studied as much as male counterpart. It's like we're still learning so much stuff. So women as a whole are underrepresented. So being an advocate for yourself and having a group to support you is very, very helpful in my opinion.
I know you half mentioned this, but I wanted to see if anybody else wanted to contribute to, because I know clients, maybe they're on it literally just for the contraceptive piece, right? Like maybe they have no other symptoms they're using it for. I personally use cycle tracking, so but I know there's a lot others, so I don't know if anybody else can contribute because I've definitely had a lot of people ask about that. I know if anybody has, I mean, I know of them, but if anybody has like some good knowledge on yeah, safer ways to not get pregnant other than birth control, other than cycle tracking. I just think people might be interested in that.
I know for myself, I never ever have been on birth control. And I was offered, but of course I always refrained from it because I didn't want it to mess up my hormones. But and I saw a lot of girls gain weight on it, and I saw a lot of girls go crazy on it. So for me personally, I just chose to stay less crazy. Um, but I use the diaphragm, which is pretty old school method, but it was effective as long as you constantly get a new one each year and refresh it. I don't know if they're still being offered. Um, I don't get pregnant anymore, so I'm not sure. But that was very effective, along with like a spermicide gel you would use in connection with the diaphragm, and there's no side effects from it.
Yeah, I would say, it takes two to tango. So I think your partner is the other piece to definitely look at with that. If you have children and, you have to use birth control to manage symptoms, if my wife's not been on birth control since we've been together, but if she was, I would potentially consider a vasectomy after we had as many children as we had. That's just something I see a lot of guys doing more of. Um, I think the spermicide makes a lot of sense as well, from like a male standpoint. What we've had most success with outside of our daughter, because we wanted to have our daughter, is being able to track cycle. I honestly feel like that's a pretty good way to get in the know and understand what's going on with your body. I would say everybody should do that. Anybody in reproductive years should have an idea of where you are, because you have to remember menstruation is a sign of health. So you really want to have your menstrual cycle, means you're making hormones appropriately, you're breaking down things appropriately, and you're excreting them appropriately. So I think with the caveat of symptoms, but symptoms mainly can be managed around bioidentical hormone support, lifestyle support, nutritional support. Those things can really make some pivotal changes. Um, yeah, I would be curious if any clients are willing to talk to us about if you're currently on birth control and are currently wanting to get off or work through that. And if no one wants to, that's fine. But uh, we have all of our experts here. So I want to make that available if anybody has questions. Totally fine. Uh, Coach Lisa, I have some questions for you. Um, in regards to like bioidentical hormones versus synthetic, have you ever taken synthetic hormones? And I know that you are currently working through some bioidenticals. We've talked about that. Do you notice a difference between the two? And I know you may be at different stages of life of using those, but if you're open to kind of talking about that, we'd love to hear that. I think practical application is kind of a great thing to have in all of this.
Yeah, yeah, no problem. Yeah, so I just started bioidentical hormones. It's been a month now. It's definitely been a little bumpy, I can't lie. And just, just feeling some different side effects. I feel like I've kind of evened out, I would say in the last maybe week or two. I'm starting to feel okay, and some of the side effects that I was feeling was a little bit of cramping, definitely some little bit of mood swings. But for the most part, like my hot flashes have gone down like quite a bit, I have to say. Like even my husband notices, he's like, "You're not taking your jacket off so much," or just like complaining about the heat and whatnot. So that's been better. My mood has definitely evened out, I would say, in the last week. I was definitely experiencing just some shifts, and those shifts were definitely happening in menopause, like a lot, and then they were just kind of erratic. I don't know if it was just more of the same, maybe psychosomatic, or maybe just, my body getting adjusted to it. So that was happening. My sleep has been amazing, Allison. I'm so happy. I'm working with Allison as well. I'm on bioidentical progesterone. I'm doing a troche, which is kind of like a little lozenge. You put it in at night. It kind of dissolves under your tongue, and my sleep has never been, I can't even remember the last time it's been this great. I probably do it around 9:30, 10 o'clock, and I go to sleep. I may wake up like once in the night, but I have to say I'm having very vivid dreams, very deep sleep. Like I'll wake up and sometimes forget like what day is it, or like what am I, what's the plan for today or whatever. So that's been feeling really, really good. I feel like that's been a game changer. In terms of synthetic, I've never done synthetic, but hormone replacement therapy. This is my first shot at doing any hormone replacement therapy. I've been in menopause since January, I think, of 2023 was my last cycle. When I went through perimenopause, it was almost like I wasn't even sure if it was perimenopause, because my thyroid was doing some weird things. So we weren't sure if it was the thyroid or if it was, perimenopause. But, I was getting my cycle like every 2 weeks, and then it was every 3 months. And then it was like whack-a-mole. It was just like, I could not track it. But I did have a feeling, it was perimenopause. I'm 49 now, so I think I was 47 or 45, like when things started to shift. Seems a little early, but my mom went through it, about the same age. And again, just tracking all those symptoms, I could tell were shifting. The sleep wasn't as great, and the mood shifts or whatever. I was on hormonal both birth control, let's see, from the time I was 25 till probably, I want to say I stopped it at 35. I was just becoming very forgetful, like taking it. And I was like, I don't think I want to be on this. And when I conceived my daughter, I have to say I was very lucky. We just were like, okay, let's, like we want to have children and whatnot. I was off of birth control for a few years because I was like 38 when I got pregnant with my daughter. And again, not to share too much information, but we tried, and it was just like that first month we got pregnant. So I was really lucky. I know I was like dialing in. I was doing a lot of I was working out, I was running races and really watching what I was eating. So, I'm hoping I attribute it to like, not being stressed and definitely taking care of myself. But hormonal birth control for me, I mean, I struggled with acne and they were like, we should put you on birth control. That was really why I went on it. Like that was the first thing. And of course, being sexually active in your 20s and all of that as well. But I didn't really like myself on it. I definitely felt kind of moody on it. From memory, I do remember feeling like I did have PMDD or some sort of, I don't know, some sort of issues with that. But yeah, that's really my experience with all of those types of hormones.
Thank you. Yeah, I think like the big thing is like with any new medication or coming off of birth control, there's definitely side effects. And I don't want to say that you know, you being or anybody, and that's it's not directed towards Lisa, but someone being in void of hormone or maybe having excess of hormone, when we change that shift in the body, you most definitely can experience some symptoms and it's going to be reacclimated. So if someone has been in menopause 2 years and they've been in void of estrogen. They've kind of lived in that low state. And as we bring those things back in, some symptoms could occur. Everything's kind of responding. And then I think with medicine, a lot of times, so there is the art of prescribing. Allison in First Optimal has a whole medical team to do that. But we also have like the art of prescribing. And what makes like bioidentical hormones so interesting is someone may need a sublingual progesterone. Somebody else may prefer an oral progesterone. Some women may need localized support with a suppository or a topical. So there's so many formulations, and that's going to be tailored to that individual. As like birth control, it's like, okay, do you want this one or do you want this one? It's kind of, you don't have a lot of choices with it. So I really think about being able to customize program design as far as hormones for people because all of us are going to metabolize drugs differently. And if you have gut dysbiosis, you may not be able to absorb oral progesterone. We see that sometimes. So that's why it's good to have all of these different options kind of based off of symptoms. Um, and Allison, I'm not going to put you on the spot too much because I know it's the first time joining with us, but I'd love for you to maybe just walk through First Optimal's process, if you don't mind, of what that looks like, who y'all are, what you do. Something pretty short would be perfectly fine.
Yeah. So, my job at First Optimal is a membership manager. So basically, kind of that uh, direct connect to the patient, work closely with the provider on protocols, but also I'm on all the consultations with the patients. You just have a person to reach out to at any time if you have questions, concerns. If I don't know the answer, I can speak with the provider and get that answer for you. Typically, once we get started, we meet with the provider on a call, kind of line out a protocol for you. It's not cookie cutter. Everybody doesn't get the same, thing. We kind of listen to goals and symptoms that you're having, things that you're wanting to address or improve, and then put together a treatment protocol for you. And then once we meet with the provider, everything is, shipped directly to your home. And then I typically jump on a call with you once you get those medications and we can go over dosing, administration, make sure you're comfortable with everything. And then you get started and, we just kind of keep in touch and, let me know how you're doing and I'll be checking in on you and just make sure everything's going well for you. And then typically 6 to 8 weeks out, you'll get another lab panel and then we'll kind of compare, your initial labs with, once you've been on hormone replacement for 6 to 8 weeks, compare those results, make sure everything's in a good, healthy range, but most importantly, make sure that you're feeling better. So we do base things off of, levels, hormone levels, but mostly just kind of hearing from you how you're feeling, how things are going for you, and we can adjust based on that as well. So yeah, just kind of, once you get in, meet with the provider, we get you going, and then just kind of track progress. Things may come up like, hey, Allison, this is going on. What do I need to do about this? You have that person to reach out to at all times, at First Optimal to help you along the journey.
Yeah, thank you so much. I think the other piece, and we hit on this a couple weeks ago, is just like peptide therapies as well. I may have somebody on this call right now who is dealing with an immune-based issue and it's not hormonal related. First Optimal is going to offer a large selection of injectable antioxidants to vitamins to peptide therapies to immune modulating medications. So it's not just HRT. I would say it's integrated just health in general. So reasons why I've worked with them worked in conjunction with First Optimal uh, since the beginning of their business is how customized everything is. I've known the owner for some time. It's a great company, lots of support, and I think it just really enhances the program here. I don't know of many other coaching outfits that offer an all-in-one shop. So, Allison, I appreciate you so much.
Yeah, anytime.
Um, Other things that I would say in regards to looking at managing symptoms and using birth control. So the other piece I see quite a bit is females coming in currently on a birth control or have a Mirena and doing lab work. What I will say a lot of times is we're going to get a lot of skewed information. Um, this is just my thoughts on it is if you're wanting to potentially make some changes hormonally, if that's impacting body composition, well-being, gut health, potentially looking deeper at some of these other things. I feel like I've seen a lot of clients, I don't know if coaches agree with me, who come in who maybe are on birth control and we're working, maybe they're here for a year and the first 4 or 5 months they're on birth control and we may hit a wall and not be able to lose as much weight or a lot of symptoms are present. But as soon as we remove some of those synthetic hormones, weight loss, mood, balancing hormones, gut health, those things do improve. I don't know if any of the coaches have, you don't have to say a name, but any examples of clients who come to mind. I have a long-term client, I believe she's one of Ashley's, who was in menopause, was using birth control for some time, had a hysterectomy. We started doing bioidentical hormones, and some things definitely improved as far as inflammation markers. I don't know if coaches would agree with me and see similar things to that. All right. Um,
I was just going to say yes. Yeah, I mean, I feel like I've had several clients who've started using bioidentical hormones and I think improved a lot of things, just like even like sleep and mental and for sure inflammation markers. But yeah, I mean, I don't have any like specific case studies to pull up, but I can say yeah, at least two or three for sure that I haven't had negative by any stretch.
awesome. Thank you for that.
Hi, hi, this is Amelia. I have a question for Allison with First Optimal.
Hi, Amelia. Happy
Hi. So
to.
I admit I'm a long-term IUD Marina going on 11 years. So um obviously if we were to start bioidentical HRT treatment, it would require no Marina in, correct? I would have to have that removed first, so then we can work off of accurate levels, I'm assuming, correct?
Typically, that's what we recommend is coming off of that contraceptive and kind of getting a baseline level of hormones because they are going to be skewed with any lab results if you're using a progestin based contraceptive. So that would be best case scenario is getting that removed and kind of reassessing baseline hormone levels once you've had that removed.
What would be a time frame? Sorry, what would be a time frame? And for example, it gets removed. What would you wait for? Okay, now let's draw your levels. Like, is there a time frame you would recommend?
So, Justin, you can chime in on this if you have any input, but I would say no less than a couple months, like 8 weeks, would be a good time frame. 8 to 12 weeks would be good to kind of let those level back out. It can take a little longer, but that could get us, kind of started with that. But I wouldn't say any sooner than 8 weeks.
Great, thank you.
You're welcome.
Yeah, I agree with you. I would say trying to get through a couple cycles, trying to see if things stabilize. Um, I think a lot of times duration kind of matters. So if you are on birth control 15, 20 years, it may be a lot longer for that response from brain to ovaries to start to pick up, versus if somebody was on it for a short time. But I think with doing labs through this program, they're very in depth. You want to get the most accurate readings. And I understand not everybody's willing to ditch some of the things that they're doing. It's scary changing things. I'm scared to change things myself. So, kind of testing the waters, maybe looking at baseline hormones. If things don't improve, you just want to keep it in your mind that that could be a potential reason why you're stalling and not at losing weight or not having improvements in cognitive function, digestive function. I think a lot of times, um, as humans, we take the path of least resistance, and we want to do what's most comfortable for us. So, just being open-minded that that could be a potential issue. And yeah, a lot of times, your OBGYN may not have the options to do bioidentical hormones for you, maybe not as well versed in it. So it can be difficult with the conflicting information. What I tell everybody is just research, be your own advocate, know what you're doing, and then you can, you know, rest assured that you've made the best choice for yourself in regards to whatever hormonal avenue that you go. What would say is I've worked in HRT space for like 5 years, and I would say the majority of the time, the bioidentical hormone route seems to be safer, more effective, and people tend to have less symptoms associated with that, like night sweats, hot flashes, insomnia. A lot of times those things I see the most symptom relief by um, using bioidentical hormones. Yes, Lisa. Oh, you're muted still. There you
Yeah.
go.
So I wanted to piggyback off of Coach Lisa. Um, I've been on progesterone since I was 39 and I'm 49. Um, because things started shifting, things started changing crazy, like, the sore breasts, the crazy periods that were out of control, like you can't leave the house type. And that was not my MO. I always had very normal, regular, balanced periods, and they just got really crazy. And I also felt like I was pregnant every single month, like that bloated feeling. So I started progesterone at 39 and I don't regret 1 minute of it. I actually wish I would have started it sooner after my first son was born because regardless of our age, hormones are hormones. And if they're not functioning properly and they're not at the levels that they need to be, then we need the help. Um, so I recently just had an increase to 150 and I just started it after my cycle ended just 2 nights ago. And the sleep, like what Lisa's saying, like last night, I had such deep sleep and felt way more rested this morning than I have been for a while. So I noticed a significant change in that. Mine is a compounded pill, is what I take. But it has saved my life, and I don't care how much it costs. I would take it for the rest of my life and whatever I need, because I know what it does, along with compounded thyroid medication too.
Is it micronized progesterone?
I don't know what do you mean by that?
I don't know that that's what's been recommended to me is to stick with the micronized progesterone.
Yeah,
Gaslighting can help us.
uh, all compounded will be micronized progesterone, and I agree. Whoever told you that, I would stick with that for sure.
Okay.
Yeah, I would say the thing around progesterone, especially if I have somebody on this call who's not peri or postmenopause, but you're having issues balancing your hormones. A lot of times people will talk about estrogen dominance. I'm sure we have all had something on our TikTok or Instagram feed about estrogen dominance, and it is most definitely a thing of not being able to excrete hormones appropriately. But a lot of times that's accompanied with low levels of progesterone. Stress, anxiety, nutrient deficiencies, lack of sleep, those things can lower your progesterone. What that can do is put you in an imbalance to progesterone to estrogen ratio. I personally really care about your detoxification pathways of those hormones, but an easy way to start working on increasing that balance is some ladies will use progesterone, maybe, days 14 through 28 of their cycle. They may not have a continuous use of it. When we use it in conjunction with other hormones like estradiol, you hear a lot of providers, if you have a uterus, you have to take progesterone to protect uterine lining. And yeah, I agree with that. If you are not using it and you are just really looking for symptom relief, you're still endogenously, so your body's still making estradiol. A lot of times we may do a cream, a couple nights out of the month, 14 nights out of the month, something like that. And that can also set that ratio off. Progesterone is going to have a lot of anti-inflammatory effects all over the body. So it's not just a hormone. What am I trying to say? It's not just a sex hormone. It's going to have a lot of functions with your immune system, your inflammation markers, how well your heart is contracting and regulating blood. I mean, there's just so much that goes into it. And we'll all be a little bit different. So Coach Lisa was saying she's doing a dissolvable. Lisa Dahl says she does an oral. And that's the beauty of it, is like just being able to choose the formation that works best for you. Usually most medical providers, which I'm not, but we have medical providers, would say that using an oral or a sublingual makes the most sense in conjunction with the use of estrogen, because we want to be able to protect that uterine lining. Estrogen proliferates and grows things. So we see a lot of times endometriosis, fibroids, that could be a loss of progesterone and or an excess of estrogen that cannot be excreted. So I really think that it's like Allison said, it's not a cookie cutter. It's a very customized to what you need. And we have people doing all different types of formulations. So Kim, you were asking about that. Are you currently on progesterone right now?
Yeah, I just hopped on the call. So I'm 59, I'm 4 years postmenopausal. I started HRT around 53, doing bioidentical topical estrogen, oral progesterone, had great effects of it initially. I started having increasing symptoms. I didn't stop having my period till I was 55. So started having increasing symptoms and my testosterone level was very low. So added topical testosterone. Had some great effects and now I've like hit the wall. I feel like my estrogen level, I mean, if I had to guess, I have a lot of gut issues that I need to work on, but I feel like my estrogen level is running too high. And when you look at these labs, my current provider, not to diss anybody, but I like to understand things. I'm a nurse and I want to kind of like, why is this happening? And I've gained like 10 pounds of weight. So I think I put on some muscle, but I've definitely got some belly fat that I need to lose. So anyway, long story short, I'm in a very stuck place with having like good results initially, and now I'm not sure what's going on in my body. all my other labs, like thyroid, hemoglobin A1C, everything. And I know you all dissect labs a little bit more, but I have horrible gut health. And I think that's a component that's affecting me. And I'm suspecting that my estrogen level is running too high, or I can't excrete it. I don't know what's going on.
Great question. Thank you for talking with us. And yeah, I think a lot of times what we see is people will pivot and say, okay, decrease your dose or do it every other day. And you're right. A lot of times you have to be able to process that. So us using the restroom, having a bowel movement is going to help get rid of toxins. A lot of times the gut, we can have reabsorption through beta glucuronidase. So basically, our estrogens are going through our different phases. They should be, I think of it when it gets to stool like a little bow on it. It's a gift, it's ready to go. But that bow loosens up and then that reabsorbs back into the body. So changing dosing, different administrations may not relieve some of those symptoms. What I
Right.
say is the testosterone also aromatizes into estradiol. So if you were maybe overburdened a little bit with estrogen, just with the estradiol therapy, bring in some testosterone, you may aromatize higher rates. Now we're getting a little bit more estrogen and we can't detox it. Absolutely. So gut health, your liver is also going to play a big role in that as well. That's what's going to break down all of your estrogens. You'll have a couple different pathways in there that are responsible for that. My recommendation, if you're having a lot of issues, would be look at doing a dried urinary analysis. A Dutch test is very helpful. It won't just show your estradiol, it'll show all three of your estrogens. It'll show phase one and phase two. It'll give you an idea if you're deficient in certain vitamins, specifically B vitamins help that methylation activity. So you getting rid of your estrogens. The last piece is the GI portion that's so important. So if someone has dysbiotic overgrowth and or they're constipated, can't use the bathroom, your intestines are going to reabsorb that and reprocess it. So it can be really problematic. With the testosterone, do you feel like you're having any negatives outside of that water retention, or would you say that's the biggest thing for you?
Um, I mean, initially it made me feel a little, I mean, this is going a couple years back. Initially, it made me feel a little angry. Um, but I had more energy and I felt like a little bit of more mental clarity. I feel like that definitely the mood stuff has tapered off. I don't know. I haven't, I hear women that go on testosterone that have like this amazing result, but I feel like maybe I'm not having that amazing result for the reasons that you just mentioned. That, when you go to a provider, like the provider the doctor that I currently see, um, he believes in doing, I get my hormones checked every 3 to 6 months, depending on if I'm having symptoms, because I'm an established patient. But then we never really do anything with them. We're just like, oh, what are your symptoms? Oh, well, if your estrogen's 300 and you're not having any symptoms, just stick with your current dose. We never adjust things. And then I've also found some issues with, lab work is hormone testing is a snapshot in time. So, one time my testosterone's 18 and the next time it's 132. Like, and then I carry into, not to take up tons of time, but, I've found even with compounding creams, like my compounding pharmacy ran out of one type of mixing cream. Like with one cream, my body didn't absorb the hormones, and with another, it did. So there's a lot of variables, in my opinion, that go into, like, I think consistency is the key. Um, but the struggle is real because I think, again, I've been with this doctor. He's okay, but I don't feel like I'm really going anywhere with him. In the beginning, it was like, oh, thank God I found someone. I feel so much better. And now I'm hitting the wall and there's just no solutions really offered.
Yeah. Yeah, and I think the other thing is the delivery system is going to be different for each person. So you see like HRT base, Versa base, those are really common forms of like topical HRT. My only things with looking at a topical form is, did you sweat that day? How clean was your skin? Did you accidentally hit the couch when you were walking by and you rubbed some cream off, or you you had any discretion or any issues with the application. What I would say, what we tend to do a lot at First Optimal, and it varies person to person. Not everybody does this, but injectable formats seem to be pretty helpful. You're a nurse, a small subcutaneous needle under the skin. You get precision dosing with that. You're also going to,
Even with estrogen?
oh yeah,
Oh,
absolutely. And
interesting.
it seems to work really well, again, if you are able to excrete your estrogens. It is going to be much more concentrated, so you take a smaller amount.
Mhm.
But as long as your body's able to process those appropriately, which we would look, you want to look at a dried urine analysis. That's a 24-hour collected sample. It's not just a single snapshot in time. So you get more aggregate data. You can probably appreciate this. The more information you have on something, the better you
Sure,
can discern what's going on. So you
sure.
your blood work along with dried urine analysis, maybe even with a GI test. Now we have a bunch of data on from when that drug goes into your system to the intermediary detox all the way to the end phase, and then being able to reverse engineer that, kind of working on those troubled spots. But I do prefer injectable formats outside of progesterone. That's usually giving oral,
Mhm.
suppository, or a topical solution. Those seem to work the best for progesterone based off of your needs. But I would say looking deeper at some other testings, there's so much you can do holistically to help get rid of toxins. The thing that worries me most about estrogen overload is if we can't excrete estrogens, we're also not able to excrete other toxins in the body. And obviously, we are have plenty of toxins in our environment. So you want to make sure that all of those things are processing correctly. So GI mapping is something we do a lot here, and then the Dutch test is something we do a lot. I'd look into those and just see like, hey, does this make sense?
I've done the GI mapping. I just, again, it was with the same doctor and then nothing, uh, again, I don't mean to be disrespectful, but there just wasn't like, okay, let's sit down and make a plan. I kind of wish I hadn't done it, spent the money, that was several years back. I actually saw him recently again and he gave me another one. I'm not sure I will do that because again, a lack of, you have information, but you don't know what to do with it. Or, um, I did want to ask you I've heard a lot of skepticism about the Dutch test. Um, I mean, can you speak to that a little bit? I've heard like it's not nearly as accurate as blood testing.
Sure. I think that's probably provider context. Maybe I think I'm gonna start with this. Just because they can do a rec form and order you a test doesn't mean they can analyze the test. So if
Right,
it's something somebody's not well versed in, they may not want to do that because they are not able to decipher the information.
right,
So you have standard immunoassay testing, and then you have LCMS, so liquid chromatography mass spectrometry. That's how lab testing will look at ultrasensitive estradiol or LCMS testosterone. Why do we do those types of tests? You also have estrone metabolites and estriol metabolites. When we do that LCMS testing, we're taking out all those other metabolites and we're actually honing in specifically on those hormones. Dutch test is an LCMS test. So I would say it is very accurate. I like standard hormone testing. We do a lot of that. I think it is helpful. But when somebody has symptoms, I tend to prefer to look at a Dutch test. And it's going to look deeper at things like androgens as well. You don't just have testosterone. We have DHEA in there. We have
right.
androstenedione. We have 5 alpha and beta DHT. Like we want to take a look at all of those. So if somebody's having symptoms, it's like you can pinpoint it down to whatever reductase or aromatase that is happening and kind of reverse engineer that. So I do think they're quite accurate. I know a lot of Dutch testing is used for breast cancer, reproductive cancer. So I would say it is a pretty solid test. I would just say most people don't read it. I have a lot of ladies come in here. It's like, hey, I had this Dutch. No one ever read it to me. I don't know what's going
Yeah.
on with it.
I think there's a lot of people, just my experience, because I've tried to find another doctor, another provider locally, and a lot of them are just very cookie cutter. You're just going in, get your labs drawn. Nobody evaluates as long as you're not having night sweats and hot flashes, you're good. It's
Yeah.
kind of how I feel like they're operating. That there's no digging deeper. Like I've gained 10 pounds and I'm working out and what is going on with my body. So
Yeah.
Do you find, I'm curious to know because I've really never analyzed injectable estrogen. Is there any, I know like oral estrogen versus topical is safer, but injectable versus topical, is
So,
there a higher risk of, I, any problems with that?
I think the biggest thing we see with the oral estrogen, similar to birth control, the clotting factors are really a
Right,
big concern. Our liver already is going to, through cytochrome P450, metabolize that drug, and then it's going to have to work through a couple hydroxylation systems to get it to the next phase. So it's just overburdening the liver through an oral.
okay,
Topical makes a lot of sense. I would say not everybody has to do injectable, but I would say topical and injectable are going to be preferred. I would never recommend an oral estradiol. The thing is with the topical estrogen, you're skipping first pass. So you're not hitting the liver at all as far as metabolizing the drug or breaking it down. You still will have those hydroxylation systems, but that clotting factor is a lot lower. What we just see is we're able to fine tune dosing. So instead of applying it and hoping it sticks, is you can just like with precision say, I'm going to reduce this 5 milligrams, 8 milligrams, however you want to do it.
right. No, it makes sense. It makes sense.
Um, yeah, I would say just being open-minded and looking at all the different options. There's just so much. And if you're not getting help, I'm assuming this is not covered by insurance, right? You're paying a cash pay service for this.
Oh, absolutely. Yeah. Yeah. I tried the traditional route of going to, my GYN and trying the little combi patch and, um, after the antidepressant and IUD and birth control pill was offered. And I turned those down. And then I had horrible like migraine headaches when I started them. I'm not a headache person, but I was like, I just can't stand this. Like it's not making my life better. I didn't give it tons of time. She said you need to give it several months. It just wasn't worth it to me at that point in time. And then I'll just be honest with you, my one of my biggest symptoms through menopause with the estrogen has been just either feeling angry or feeling like nothing. Like my mental health was struggling a lot with through menopause, and that's a lot of what drove me. I mean, I was having the night sweats and the other things, but my number one symptom was just not feeling like myself in any way. So,
Well,
you know,
you need estradiol to help make serotonin. So if
yeah.
you don't have any of that, like I totally makes sense.
Yeah, I mean, again, so that was a lot of my draw. I did want to ask you, like, if I was someone who joined your programming, and again, I don't know how many people are on this call, but I don't want to
No, go ahead.
take up too much time. If I was someone who joined your to work with your team, and I come to you on my current HRT, what is that transitional I mean, obviously labs. I just spoke to Davey on the phone, and he asked me to send my most recent labs because am I on with a bunch of people?
We do have a couple of people. We can totally talk offline if you want.
Okay. Yeah, I just don't want to be monopolize the whole conversation. But I been down this road before, and it's not that I have distrust. I've done my due diligence, but I just would like to better understand process things before I make a commitment. I'm
Yeah.
actively looking for help. So it's not that I need a hard sell. I just want to, understand the process.
Well, I would tell anybody on this call, always be skeptical, always question things. I think that's a good thing to do. You need to work your way through it and feel comfortable. So, like, I think that's great that you are wanting to have more information instead of diving in. I'd love to talk to you. I'll
Okay.
message maybe after this and see if we can sit down and uh,
Okay.
just work through it, make it rational for you, and put it together of why you would want to do it. And
That's
look,
what I need because I've been working with other avenues of, traditional medicine, functional medicine, and I just really feel like I'm at a spot where I'm open to help. I just need to understand, like, I feel sort of hopeless. I'm just being honest with you. So I just can't seem to get anybody that's vested in looking at entire picture. Instead, it's, sell you on this. I only do this and and it's very hard.
yeah. Well, that's the whole reason we have this call. So we have a registered dietitian who's the gut health GI map stuff. I do mainly the endocrinology stuff. I have Allison here. She works for the hormone company. We had a couple other coaches on. We can walk you through that process and let you see
Okay,
what it's like.
that would be great.
Yeah, we'd love to do that.
Okay,
I'll send him a message after this, and then we can find a time for us to sit down and look at it all.
okay, that'd be great. I'd really appreciate that.
Yep, I'm looking forward to it.
Thank you.
Yes. Um, we are at time, everybody. I want to thank everybody for coming. I love doing this, and I hope to see more of y'all next week. Kim, I will reach out and we'll be in contact.
Okay,
Allison,
great.
thank you for joining.
Yep. Thanks for having me.
Yes,
I'll be back at some point.
sounds good.
Thank you.
See you
Thank
guys.
you.
Appreciate your time. Thank you.
Thank you.
Bye.
Thanks, bye.